Greetings, and welcome to Vital Edge Health. I'm your guide today, not just as a presenter, but as an educator committed to helping you understand complex health topics with clarity. Today's subject is one that affects millions of older adults worldwide: diabetes. I aim to bring you a deeper, evidence-based understanding of this condition. Did you know that approximately 1 in 3 adults over 65 is currently living with diabetes? Yet many remain confused about what it actually is, how it works, and what they can do to regain control over their health. In this masterclass-style video, we will explore what diabetes is from a biological and medical perspective, the critical differences between type 1, type 2, and prediabetes, subtle and overt warning signs, scientific insights into long-term complications, evidence-based treatments, nutritional biochemistry for better food choices, gentle, medically safe exercise routines, and, most importantly, daily health behaviors rooted in science. Let's begin with the foundational question. What exactly is diabetes? Biochemically speaking, diabetes mellitus is a metabolic disorder. It arises when the body fails to regulate glucose, the primary fuel for cellular energy, due to problems with insulin, a hormone produced by the pancreas. In healthy physiology, when you consume carbohydrates, your digestive system breaks them down into glucose. This glucose enters the bloodstream, triggering the pancreas to release insulin, which acts like a key, unlocking your cells so glucose can enter and be used for energy. However, in people with diabetes, this process is disrupted. Either the pancreas doesn't produce sufficient insulin, or the body's cells become resistant to insulin's effects. As a result, glucose accumulates in the bloodstream, leading to a condition called hyperglycemia. Types of diabetes. Type 1 diabetes, an autoimmune disorder where the body attacks insulin-producing cells. Less common in seniors, but still possible. Type 2 diabetes, the most prevalent form in older adults. It's largely influenced by lifestyle, weight, and genetics. The body becomes insulin resistant. Prediabetes, often overlooked. This is a warning stage where blood sugar is elevated but not yet in the diabetic range. It's reversible with intervention. Warning signs and symptoms. The human body often gives us early signals when something is wrong. Recognizing these early signs can make all the difference. Common symptoms include polyuria, frequent urination, polydipsia, excessive thirst, unexplained fatigue, blurred vision, slow healing of cuts or wounds, tingling or numbness in extremities, unexpected weight loss. These symptoms occur because excess glucose damages nerves, disrupts vision, and impairs circulation. Unfortunately, many seniors dismiss these signs as part of normal aging, but these are not normal. They are physiological warning bells. Long-term complications. If left unmanaged, diabetes can quietly damage multiple organ systems. Let's examine what long-term hyperglycemia can lead to. Cardiovascular disease. Elevated glucose damages blood vessels and increases the risk of heart attack and stroke. Diabetic nephropathy. High blood sugar can impair kidney function, sometimes requiring dialysis. Neuropathy. Persistent glucose toxicity damages nerves, especially in the feet, leading to pain, numbness, or ulcers. Retinopathy. The tiny vessels in your eyes are sensitive. Uncontrolled diabetes can lead to vision loss and even blindness. This isn't to alarm you, but to empower you. Knowledge is the first step in prevention. Diagnosing diabetes. Diagnosing diabetes is done through a combination of blood tests. These aren't just numbers. They represent how your body is handling glucose at different times. Fasting blood sugar test. After 8 hours of fasting, your glucose level should be below 100 mg/dl. A1C test. Measures average blood sugar over 2 to 3 months. A reading of 6.5% or higher confirms diabetes. Oral glucose tolerance test. Measures your body's ability to manage sugar after a glucose-rich drink. If you are over 50 and haven't had an A1C test in the last year, it's time to schedule one. Treatment and lifestyle management. Let's talk about solutions. Diabetes management is multifaceted. It's not just about pills. It's about daily, informed decisions. Medication. Metformin, first line for most type 2 cases. It decreases liver glucose production. Insulin therapy, essential for type 1 and some advanced type 2 cases. SGLT2 inhibitors and GLP-1 agonists, newer drugs that not only control sugar but reduce cardiovascular risks. Nutrition. Favor complex carbohydrates, whole grains, legumes. Prioritize fiber. Promotes slow glucose absorption. Minimize added sugars and highly processed foods. Glucose monitoring. Self-monitoring reveals how different foods and activities affect you. Continuous glucose monitors (CGMs) offer real-time data. Psychological resilience. Diabetes burnout is real. Join support groups or talk to a health coach. Best foods for seniors with diabetes. Let's look at food not just as calories, but as chemistry. The right nutrients can reduce inflammation and enhance glucose metabolism. Dark leafy greens, high in magnesium and fiber. Berries, rich in antioxidants without spiking sugar. Whole grains, oats, quinoa, barley. Legumes, rich in fiber and protein. Fatty fish, like salmon, helps with inflammation. Nuts and seeds, healthy fats and satiety. Foods to avoid. Refined carbohydrates, white bread, pasta. Sugar-sweetened beverages. Deep-fried items. Hydration tip: water is best. Cinnamon or fenugreek teas may modestly help with glycemic control, based on emerging studies. Safe exercises for seniors. Movement is medicine. For seniors, the goal isn't intensity, it's consistency and safety. Effective options. Walking. A brisk 30-minute walk can lower glucose for hours. Tai Chi enhances balance and reduces stress hormones. Chair yoga, ideal for those with mobility concerns. Resistance training helps regulate blood sugar by building muscle mass. Always consult your healthcare provider before starting any program. Daily habits to maintain healthy blood sugar. Your daily rhythm, the choices you make every hour, determines your outcomes. Eat regular meals. Skipping can spike or drop sugar unpredictably. Sleep 7 to 8 hours. Sleep deprivation worsens insulin sensitivity. Stress management. Chronic cortisol elevation raises blood sugar. Medication adherence. Use pill boxes or smartphone alarms. Social health. Isolation affects physical health. Stay engaged. You now hold a comprehensive framework for understanding and managing diabetes after 50. If this video brought value to your life, please support VitalEdge Health by liking, sharing, and subscribing. Remember, health literacy is health power. Stay curious, stay active, and stay well.